I'm Dr. Amer Raza. I'm a consultant gynecologist in London. I have a special interest in fibroids and minimal access surgery or laparoscopic surgery. Today I will talk about fibroids. It's a very common problem among many women. In most cases, fibroids are asymptomatic, not known, and first time you will ever know about fibroids if you're having scan for other reasons, such as pelvic pain, or early pregnancy scan, or a general check. I'll try to go through questions about what are fibroids, how they grow, how they present in many people. Once diagnosed, what should be done? What are the different treatment options from medical to surgical options? It's quite a big topic, but I'll try to go through as many concepts as possible. But if you still have questions, feel free to drop one and I will try to come back to you on that. Fibroids are cell balls, or growth of cells within the muscle of the uterus. The uterus or the womb is made up of three lining. One is inside lining, or we call endometrium. One is middle lining made up of muscles called myometrium. And the last is outside lining called as serosal layer. The fibroids grow from the muscular middle layer of the uterus. Cells simply start to develop and start to grow larger and larger. These are common in Afro-Caribbean women, but all women of different races can have it. There are many theories why fibroids grow, but we see them, they are very common in obese women, in women with increased estrogen, and there is a genetic and familial link as well. The symptoms of fibroid will depend on where these fibroids are. But it's important to note that 75% of fibroids will be asymptomatic. The symptoms from fibroids will depend where these fibroids are. Once these fibroids start to grow from the middle layer, then either they can grow inward, called as submucosal fibroid, or they will grow outward, called subserosal fibroid, and sometimes they grow within the walls and uterus becomes larger, called as intramural fibroids. If the fibroid is growing inward toward the cavity of the uterus, submucosal fibroid, these will mostly give problems with heavy periods, irregular bleeding, and in some cases they also have been linked to subfertility as well. Subserosal fibroids grow outside the uterus, and as they grow outside the uterus and outward, they give lots of pressure symptoms. Not that when they are small, it's only when their size is large, then they will cause increased frequency of urine, bowel problem like bloating, pressure effect on the bladder, on the bowel, and something in the pelvis. They can grow to a very large size, so large as they can come all the way to xephisternum. Intramural fibroid also has similar pressure effects simply due to their size. If you're diagnosed with fibroids, then there could be two ways. Either you're suffering any of the above symptoms, or you just have an opportunistic diagnosis because you're having scan for some other reason like early pregnancy or pelvic pain. Once fibroids are diagnosed, then there are certain ways to confirm their presence and type of the fibroids. Ultrasound scan is the first line investigation along with a bimanual vaginal examination to see what kind of fibroid you have. Ultrasound scan is a very good diagnostic tool and tells a lot about fibroids. Fibroids are almost always benign. The risk of cancer with fibroids is rare. Once you see your doctor, they may decide to do further investigations such as MRI scan or a hysteroscopy to check further about the nature of fibroids, the exact site and size of the fibroids. Now we come to treatment of fibroids. How do we manage them? I'll try to take you through different scenarios for the management and treatment of fibroids. I've already established that asymptomatic fibroid do not need any treatment. They can be simply observed and followed in any clinic. One of the medical treatments, early medical treatments for fibroids is to give you tranexamic acid. This can be given 1 gram orally 3 times daily for the first few days of your period to reduce the heavy flow of the bleeding. This can be also coupled with hormones such as progesterone in the form of Provera, norethistérone to help you. These medical treatments are definitely helpful first-line management to reduce the heaviness and also help the symptoms until you get to some definitive treatment. The surgical option of removing the fibroid completely depends where these fibroids are and what problems they are causing. If the fibroid is submucosal, which means fibroid is growing toward the cavity of the uterus, which will possibly be giving you heavy periods, irregular bleeding, and subfertility in cases, then the solution will be to carry out hysteroscopy. Hysteroscopy is an operation in which a small camera tube is inserted through the vagina inside the uterus, and we can see the fibroids on a television screen. The fibroid then can be resected or removed through the camera completely. I will talk about this procedure and its complication in detail in a different video. The other fibroids are subserosal or intramural fibroids, which give pressure symptoms and also contributing to heavy periods and in some cases subfertility. These fibroids can be removed by various surgical options. These surgical options will depend on the site of fibroid, size of fibroid, and the expertise of your doctor and your local hospital. If the fibroids are very large, for example, they are extending all the way to the sternum and they have grown to that size, then the option will be to carry out open myomectomy, in which you will have an incision on your abdomen, either a transverse incision lower down below or a vertical incision. And the fibroids have been removed through a procedure called open myomectomy. The alternative approach is to carry out laparoscopic or a keyhole approach. Laparoscopic keyhole approach is suitable for the fibroid, which measures up to 10 to 12 centimeter. The recent introduction of robotic surgery now is allowing us to treat even bigger fibroids in difficult places safely. There are many other options as well, which you will hear in the clinic, and alternatives depending on where you are being treated. One of them is uterine artery embolization. Uterine artery embolization is a method in which once your family is complete, you can have this minimal operation in which no cut was made on the abdomen, but the procedure will be carried out in a radiological department. The small wires are inserted through the veins to block the uterine arteries which supply blood to the uterus and the fibroids. Uterine artery embolization is effective in 50% of the patient, however will not be effective for women who are trying to conceive or planning to conceive. There are many indications and evaluations which need to be carried out, including MRI scan, and your doctor will be discussing in detail if you're suitable for this kind of treatment. MRI focused ultrasound treatment is also another option to reduce the size of fibroid, however available in very few places and efficacy of 40 to 50%. If you have any question about fibroids, feel free to drop a question and I'll try to answer it. Thank you.